Yeah.
Namaskar and a very good morning, friends. Welcome to Canada India Foundation and all our partner organizations session 13 on virtual lecture series on pharmacological and therapeutic effects of top 75 traditional Ayurvedic medicine. And we have very expert speaker. We are very, very proud to have along with us, Dr. Rohit Madhav Shaneji, Managing Director, CEO of Madhuka Bark Clinics and Hospital, which is a very, very renowned, a huge chain of hospitals, particularly focusing on the cardiology side. We are very excited to welcome and looking forward to listening to him. We have our expert speaker, Dr. Jeevan Prakash Chaudhary ji and Vaidya Meenakshi Gupta ji. And today is a very special session. It is a session 13 of our bi-weekly speaker series. And we're looking forward to today's exciting presentation. And of course, it is being championed by our none other than Vaidya Harish Verma ji, Pallavi Joshi ji, Akhlesha Raj ji and Palvish Sodhi ji, and Madan Thangawala ji. Over to you. Looking forward to today's great presentation.
Steve ji, namaskar. Thank you very much. And good morning to all viewers and welcome to 13th session of virtual lecture series on pharmacological and therapeutic effects of 75 traditional Ayurvedic medicines. However, we will bring more traditional medicines later on. So this is the first phase where we have selected 75 traditional Ayurvedic medicines. So today our topic will be on pharmacological and therapeutic effects of Arjunarishta. And our special guest in this morning is Dr. Rohit Madhav Sen, who is Managing Director and CEO of Madhuka Bark Clinics and Hospitals in Mumbai. Dr. Rohit Sen is MBBS doctor from modern medicine, but he has special interest in Ayurveda and he is using his education to modernize Ayurvedic medicine. And he undertook meticulous research into Ayurveda. Dr. Rohit Sen presented his various research papers in the field of cardiology, including one research paper, Effect of Sampuran Hridaya Shuddhikaran, literally means total purification of the heart. And we will listen from him what is the concept, this Sampuran Hridaya Shuddhikaran. And today we have two experts who are experts. One is Dr. Jeevan Prakash, who has a vast experience of developing new products in Ayurveda. He has developed one pain-killing spray, and another, he has developed a gum tightening toothpaste, and he has also developed many more products. And he has also specialized in drafting the application for IPR, intellectual property rights, for getting any product patented. He is expert in suggesting claims, what should be the claim. And we will also listen from him about his experience in about the patents of Ayurvedic medicine. And today we have also expert speaker, Dr. Meenakshi Gupta, who is a founder and director of Ayur Roots, Ayurveda Wellness Center in Texas. She currently practices in Dallas, Fort Worth area and has worldwide clientele. And she has vast experience of using Ayurvedic medicines in USA. So we will also listen her experience about Arjunarishta. So without wasting any time, I will invite Dr. Madan Thangawala to moderate the session. Over to Dr. Madan Thangawala. Thank you.
Harishji, namaskar. Thank you for bringing us all together once again and to look at another very important formulation. The spirit of these meetings and these engagements is just to give a taster, to understanding traditional Ayurvedic medicine. So we will be strict on our time, share the most salient points. Number two, there is a general lack of understanding that these formulations are in fact very powerful medicines. And this is today's discussion is about one such formulation. Now, what is the larger context in which Arjunarishta works? It is in terms of the total global disease burden. If I take the liberty of just sharing my screen, and if you look in here, you will see that this is from the World Health Organization, the top 10 causes of death. If you look in here in 2019, the top 10 causes of death, and it is shown here, high on the list is ischemic heart disease. And the second, stroke, cardiovascular. There's the complications related to the heart and the circulatory system. If you move into another aspect, which we sometimes don't understand fully, the cost of healthcare expenditure and burden. This is from one of the UK research sources, the British Heart Foundation. If you look within here, you will find many subsections, the statistics visualized, etc., death rates over time, and treatments and medications. If you look within there, you will see some information. I won't go into this, but I'm just pointing you to that. And the second one, the costs of healthcare expenditure on heart and circulatory diseases for the European Union member states. Data is slightly old. Now, this is the bigger context. These statistics are frightening, and this is the world over. And these are set to increase, both the numbers and the costs involved, because there is a huge shift in our dietary patterns. A recent report for the UK says that almost 50% of the food consumed in UK today is ultra-processed foods. And they are the leading cause for obesity and all the related problems. They are a leading cause for, and these are big complications. And we're delighted to have today a discussion on the topic of Arjunarishta, which has been known for thousands of years. And more than that, we're delighted to have learned scholars. First of all, Rohitji. Rohitji, welcome. Thank you for joining us. We know that you come from a long lineage, if I may use the word, of people involved in human health and care, and you are the pioneer of this Arjuna Bark centers across Maharashtra and across India. We are delighted you are here. For those in the audience who may or may not know, Rohitji's father himself was a very learned teacher and a Vaidya. And in fact, Pallavi Sodhi, who is here with us, she was taught by Rohitji's father. I will stop here, but welcome. Thank you for finding time to be here with us today. We look forward to learning from you. Thank you, Rohitji.
Thank you. Thank you. Thank you, Dr. Madan. I would take the liberty of sharing my screen over here. I hope the screen is visible.
Yes, very clear. Thank you, Rohitji. Thank you again.
Thank you very much once again. To introduce myself, I am Dr. Rohit Madhav Sane, the founder and director of Madhuka Bark chain of clinics and hospitals all over the nation. We have about 275 centers all over the nation. We are there in Maharashtra, Madhya Pradesh, Uttar Pradesh, Gujarat, Goa, Karnataka, Delhi. And in few months coming down the line, we will be there in the UAE also. So to give a bit of what Madhuka Bark's mission is about, we go ahead with a clear mission of reducing down the global cardiac mortality. As Dr. Madan just said few minutes back, I completely agree to what he said. The total situation all around the globe related to cardiovascular disease is quite scary. So it's now high time that Ayurveda, who believes in lifestyle modification, who teaches and preaches the lifestyle modification science, is the only pillar that the world will be able to believe and depend to reverse these heart diseases and reduce down the global burden of heart disease all over. So, as we go ahead, as Dr. Madan rightly said, overall global burden of heart disease, we see that about 17.9 million deaths happen all over the globe related to cardiovascular diseases. As well, out of the total deaths that happen all over the world, about 32% of those deaths are related to cardiovascular diseases, and most of them are related to myocardial infarction, which is due to ischemic heart disease. So looking at these all statistics, as Dr. Madan said right now a few minutes back, the whole burden, the economic burden that the whole world is carrying, as well as our nation, India, is carrying, is too huge. So if at all we go deeper into the Indian statistics, we could understand that in spite of having a good innovation by modern medicine related to angioplasty and other revascularization procedures, we could see that the disease of heart has led to more number of deaths in past so many years. So over here, cutting from Times of India clearly mentions that about 34% of deaths have increased in last 26 years. And more shocking is in 1990, before the invention of angioplasty and bypass surgeries in our nation, 15.2 was the death rate due to heart diseases. While in 2017, instead of reducing down the deaths have increased to 28.1%, which clearly shows that modern medicine has not been able to curb the disease rate nor the mortality rate. So I believe that heart disease is basically a lifestyle disorder. And if at all a lifestyle disorder has to be treated and reversed, we need absolute lifestyle modification. And whatever I have read after my modern medicine studies in Ayurveda, I could understand that this is the only science which speaks about lifestyle modification. So I'm damn sure about this concept that it's only Ayurveda which will be able to reverse heart disease all over the globe. As we go ahead, about today's topic is basically Arjunarishta. If at all we go through the shloka of Arjunarishta, we could see that Arjunarishta, the indications for Arjunarishta which have been mentioned is typically Rut and Phupus. That means cardiopulmonary disorders will be the target disorders for Arjunarishta. When I was doing my MBBS, when I was doing my fellowship in cardiac rehab from Apollo Hospital, there was a basic textbook written by Dr. William Hurst, and that was called as The Heart. All those 5,000 pages that I read from that book, and after reading this book, I went through the text of Ayurveda. When I went through the text of Ayurveda, there were n number of shlokas that I went through. And what I understood was a simple shloka like Dushayitva rasam dosha vigunatam rudayam gata nana badha prakurvanti rudrogam tam prachakshate. This simple two-line shloka gave me complete understanding of what Dr. William Hurst was trying to say in those 5,000 pages of his book, The Heart. Hence, my interest towards Ayurveda started increasing, and that is how I am going to present the whole modern view of Arjunarishta and how can we take it ahead to reduce down the total global burden of heart disease all over. So in this Arjunarishta, we could see that most of the dravya that have been explained in preparing this Arjunarishta are majorly related to create some kind of self-generated alcohol in it. Normal chemical analysis of Arjunarishta mentions that about 6 to 22% of alcohol can be generated in Arjunarishta. The best would be about somewhere about 7 to 10% of self-generated alcohol, which would be the best. But as a whole, when we look at Arjunarishta through a modern point of view, I could see that this is nothing else but a wine made up of white or black grapes, and Arjuna having its major alkaloids into it. So n number of phenolic compounds, n number of glycosides would be coming into this wine, and this would create Arjunarishta. That is what a simple understanding from a modern medicine graduate like me. And this Arjunarishta will have a great role in treating disorders related to heart and disorders related to lungs. There are n number of studies which have already proven the role of Arjunarishta in lungs as well as improving the FEV1, the forced expiratory volume in the first second. That is a typical individual parameter to decide the longevity of life as well as the mortality index post myocardial infarction. As well, there are other parameters which are equally important, which will help us to reduce down the global cardiovascular disease burden. As we all know, the causes or else the predisposing factors for cardiovascular deaths could be n number of them. I have selected few of them. The first one, as all of us know, is myocardial infarction. Now, as soon as the myocardial infarction comes in, the second stage of disease, that is called as cardiac failure due to fluid overload, creeps in. This again leads to major mortality post myocardial infarction, as well as the fibrosis that happens during myocardial infarction and the 6 weeks duration later myocardial infarction. This fibrosis decides whether this person's ejection fraction will be restored or whether it would not. And this whole fibrosis that happens inside this heart muscle, the myocardium, this all happens due to the oxidative damage that happens during this whole process of myocardial infarction and its healing during revascularization. Along with this, hyperglycemia, the blood sugar levels again help the doctor to decide the mortality of this patient, whether this patient will have a good life post myocardial infarction or not. One of the most important parameters is going to be the blood sugar levels as well as the HbA1c. Along with this, myocardial infarction can be a result of dyslipidemia. All of us know the higher LDL levels, the lower HDL levels would be the basic causative reasons behind atherosclerosis or dyslipidemia, which would be a cofactor for myocardial infarction. Along with these things, as we all of us know, hypertension is the most deadliest thing that is happening all over the world. More than about 23 to 25% Indians are already hypertensive, but least of them know that they are hypertensive or they don't agree to the point that they could be hypertensive. And the whole unawareness or uneducated part of this cardiovascular disease again leads to the total burden of cardiovascular disease deaths. Now, the question arises whether Arjunarishta can be a hope to reduce down this overall global cardiovascular disease mortality or not. Hence, the answer came up with n number of studies. We could see that Terminalia Arjuna extract related to alcohol, the ethanol extract of Terminalia Arjuna, which I normally consider to be something like Arishta. As we all know, that is self-generated alcohol, and ethanolic extract is nothing else but an alcoholic extract of Arjuna. I believe that the scientists like Sushrut and Charak must have extracted Arjuna in alcohol to get the maximum efficacy of Terminalia Arjuna, and that is what they named as Arjunarishta. If we go by this understanding, we could see that the LDL levels, which increased to about 862 milligram in animal study, post high fat diet of 72 days, we could see the same animals when they were treated with Terminalia Arjuna alcoholic extract, post 72 days, they helped, this Arjunarishta helped these animals to reduce down this LDL increase to about 37% lesser than what high fat diet had led for. This clearly gives an idea that if at all Arjunarishta can be utilized in atherosclerotic patients to control their LDL levels, I am sure the perforation of the atheroma that happens due to lipid oxidation, that could be halted because of Arjunarishta, and that could help us to reduce down the global cardiovascular deaths. Along with atherosclerosis and lipids, Terminalia Arjuna has also seen to exert a great effect on HTN, that is hypertension. In hypertension, we could have seen that there are n number of medications in allopathy which help us to reduce down the blood pressure by various different methodologies. Few of them are calcium channel blockers, few of them are vasodilators, few of them are angiotensin converting enzyme inhibitors. But Arjuna has shown to have a great improvement in hypertension through a different mechanism, through a peripheral mechanism, and not related to these mechanisms. And many a times it has been seen that the effect of anti-hypertensiveness because of Arjunarishta has been seen to be complemented by other medications like herbs like Dalchini and Vekhanda. But at the same time, this effect of anti-hypertensive effect of Terminalia Arjuna in Arjunarishta was counteracted by metoprolol like beta blockers. So many a times this has also been said that Terminalia Arjuna or Arjunarishta, or else it could be the alcoholic extract of Arjuna, must have some effect on the beta adrenergic system also, which would lead to bronchodilation also. So the earlier shloka that we have read, which clearly says that Rut and Fufus Gadan, that means the diseases related to heart and the pulmonary system, both can be equally treated with Arjunarishta. So this can be proven through this slide. Along with that, the most deadliest risk factor of cardiovascular disease, which is called as diabetes, in over here, it has been seen that if at all animals which are fed with high glucose diet, high carb diet, the blood sugar which was seen to increase to 302, those animals, if at all they are treated with Arjuna extract of alcohol, or else it would be called as Arjunarishta, the reduction in the blood sugar levels has seen to be more than 62%. So this clearly helps us to understand that a single preparation of Arjunarishta can be beneficial in controlling various risk factors which could lead to myocardial infarction. At the same time, when we see that there is a huge amount of fluid overload, we normally in modern medicine try to utilize drugs like Lasix and Lacilactone to reduce down the fluid accumulation inside the body to further prevent the complications of cardiac failure in a myocardial infarction patients. Now, Arjuna extract, the alcoholic extract of Arjuna or else Arjunarishta can be even proven to be a great diuretic which can be fairly equivalent to that of Lasix in cases of cardiovascular failure. Hence, Terminalia Arjuna, it has been clearly been mentioned in n number of various research papers. As I said few minutes back, Terminalia Arjuna alcoholic extract has a clear effect on the glomeruli by increasing the glomerular filtration rate, which again relates to renal disorders also. And over here, what we need to understand is Arjunarishta can be a good medicine to be utilized wherein during cardiac failure, the renin, angiotensin and aldosterone mechanism goes out of control, which makes the condition worsen for the patients. Over here, we can understand that Arjunarishta can be a classical agent to break open this cascade of renin, angiotensin, aldosterone mechanism, and that could help to stop the overall failure that happens post myocardial infarction. And this again will help us to reduce down the global cardiovascular deaths happening all over. Hence, Arjuna can be termed as a beautiful diuretic, which can be utilized for fluid overload patients also. Along with this, the most important thing is called as reduction in ejection fraction. The pumping power of the heart, as soon as it reduces, the overall mortality of a heart patient increases like anything. There are n number of researches which show that once a patient is diagnosed with cardiac failure, next 2 years, 50 to 60% deaths happen in those crowd of patients itself. Hence, what we need to understand is, if at all we could understand this whole process of reducing ejection fraction post myocardial infarction, and an agent like Arjunarishta can play a role or not, was a question that there was in my mind. What I tried to understand was, post myocardial infarction, what decides the ejection fraction is the cardiac fibrosis. Post death of these cardiac muscles, the number of heart muscles that undergo fibrosis, that undergo death, that undergo fibrosis, determines the amount of ejection fraction that is going to reduce down. So, many a times angioplasty research papers clearly try to mention that angioplasty tries to reduce down the fibrotic scar on the myocardium. The lesser the scar on the myocardium, the lesser would be the mortality in these heart patients. And in over here, it has been clearly mentioned that the oxidative stress that reduces down with the help of Arjunarishta, we could see that the fibrosis that has been caused on the cardiac muscle can reduce down many folds, and thus this will help the patient to preserve his ejection fraction even though he has suffered a heart attack. So if at all we can propose Arjunarishta for each and every individual who believes in prevention and doesn't want to fall a prey for cardiac mortality, I think Arjunarishta would be the best agent that can be used to reduce down this global mortality. Hence, as a whole, we could summarize that if at all Terminalia Arjuna alcoholic extract or Arjunarishta is being utilized for patients as a tool of prevention, as well as a anti-hyperglycemic agent, as well as in patients with dyslipidemia, as well as a patient of stress, it would be physical or it would be psychological, which leads to oxidative damage, as well as a renin-angiotensin-aldosterone mechanism breaker in case of renal, as well as hypertensive heart cardiomyopathies, as well as the finest of all, which is the deadliest of all, that is coronary artery disease, which leads to myocardial infarction. As a whole, this whole cascade can be broken by a single hero, and that is nothing else but Arjunarishta. So as the end, I would like to summarize that Arjunarishta can be a single tool, a single most effective tool to prevent cardiovascular disease mortality for our whole globe. Thank you very much.
Rohit, thank you so much for a very, very clear presentation. Now, many of our audience are asking a very important question. How come you are so fluent in Sanskrit and Ayurvedic concepts and in modern medicine? So this is something that is possible. If it is, I always say that if it is possible for even one individual, it's possible for the whole world. And you have given us here an excellent introduction to how it is possible to integrate both this. Harishji, please.
Yes, sir. Rohitji, it was a wonderful presentation. Thank you very much. And I want to draw your attention that this Arjuna alcoholic extract and Arjunarishta. So we have two experts. They will also guide us. And we have today Dr. C.V. Jha with us. He is a Bhisham Pitama of Vaishajya Kalpana. He's super.
Namaskar to all of you
and
this evening.
And sir, Today we will also learn from you that Arjunarishta, we are losing some important ingredients while making Arjunarishta because we boil Arjuna in water, then we make Arjunarishta. That means we are losing alcohol-soluble ingredients, alcohol-soluble elements. So how we can modernize it? Can we make Arjunarishta while after drying hydroalcoholic extract from Arjuna? This is one point. And second, the content of sugar level is very high in the traditional formulation. How we can improve this? So we will learn first from our experts. Then we will also learn from Dr. C.V. Jasar. Over to Dr. Madan.
Thank you. Jasab Pranamji, we will come back to you, Ji, after we have had the presentations from our expert speakers. Rohitji, please stay with us if you are not rushing, because we want to bring you back into some discussions. The whole question about the heart and how it is understood in Ayurveda is incredible. The very essence of that word and the complexity. Here, for a few seconds, I just want to highlight this. This is a paper that comes from Switzerland, from the Department of Vascular Surgery and Cardiac Surgery and Transplantation at the University of Zurich. And it talks about the baroreceptors in the aortic arch and their potential role in aortic dissection and aneurysm. But the point I want to say here is the complexity of that one organ. And the complexity is represented here in just one section of the heart, just the arch of the aorta. When you look at it in close, you have the intima, you have the media here, the adventitia, and in the adventitia are certain neurons. And if you look at the ends of these neurons, you see a collection of ion channels that are that is the intelligence. Each of these are little sensors of the physiology of the body. They in turn send signals to the brain, and the brain sends signals to the heart, and the heart compensates. And for all of these reasons, the heart is called the Moolastan of Pranavaha Shrotas. The whole essence of life is running through the heart. The heart is the central coordinator. And we will hear from our two expert speakers, their understanding of this formulation and a little more. I invite our first speaker for the day, Harishji.
Dr. Jeevanji.
Dr. Jeevan is, yes. Jeevanji, namaskar. Have we lost Dr. Jeevan?
No, he's there. So please unmute, sir.
Jeevanji, namaskar. Please unmute. We are delighted you have joined us. We look forward to learning from you.
Yeah. Thank you.
I have Jeevanji, one question. If in 1 minute you can tell our audience how you came into Ayurveda and what inspires you. Just you have only 1 minute, keep it brief because we want to learn more about the subject.
Yeah, sure. Actually, my native where I was in a very village place, but there was an Ayurvedic doctor, and I was very much impressed due to instant result. There was so much allopathy doctors, but he was a very eminent doctor, and he was giving an instant result. So I was very much impressed. So hence there is a very much difference in the treatment of allopathy and Ayurveda. So that is the reason.
Thank you, Ji. Welcome. Thank you. Welcome to the platform. Now we look forward to learning from you about today's formulation.
So I will share my screen. Share my screen. Yeah. Yeah. Welcome you all. So my today's topic is pharmacological and therapeutic effect of Arjunarishta. So basically, my introduction is I am a Dr. Jeevan Chaudhary, HOD manager at Sandoz Pharmaceuticals Limited.
Jeevanji, sorry to interrupt. Could you put this on presentation mode if you can, so that all of the information is displayed?
Full screen.
Full screen?
Yeah. Screen. Okay. Full screen.
You have to go to press. Yes, thank you.
Yeah.
There we are. Thank you very much.
Yeah. Okay. So
Thank you.
welcome you all. Today's topic is pharmacological and therapeutic effects of Arjunarishta, and myself, Dr. Jeevan Chaudhary. So we will be looking for Arjunarishta introduction, Asavarishta preparation, formulation of Arjunarishta, Arjuna, Draksha, Dhataki, and Madhu. These are the ingredients of Arjunarishta, and we will see brief details of this. Then traditional preparation of the Arjunarishta, modern preparation methods that is using in the pharmaceuticals. Then Arjunarishta indications and researches based on the Arjunarishta. So Arjuna, the name is from Partha. That is the from Partha, which is the from Mahabharata character, and he was the chariot of this Ratha, that is the Parthadyarishta. So the holistic science of the Ayurveda and the several Ayurvedic textbooks named the Sharandhar Samhita and Charak Samhita strongly vouch the magical tonic as a remedy using for the Rudya, that is the heart, cardiac problem or heart problems, Dipan, Pachan, Mutraghat and Shothar. These are some indications of the Arjunarishta. So we will see the basic concept of the Asava and Arishta. So Asava and Arishta are the basic concept. The Ayurvedic medicinal properties of this Asava Arishta are that is sugar and Jaggery are the major components of this Asava Arishta. So first of all, the raw herbs or raw materials of the Ayurvedic raw materials. These are gathered, and then the water is added, and then these are soaked for one whole night. Then it undergoes fermentation process, and the alcohol is generated, and the alcohol is generated is preserved, and then it is packed so that the Asava and Arishta is prepared. So basic difference in the Asava and Arishta is Asava is the swaras, that is the juice of that fruit or that raw herb, and Arishta is the decoction of that herb. So if we see that Draksha Arishta and Draksha Sav, the basic difference of that is the Draksha. If we use the juice of that Draksha, it will be Asav, and if we use the decoction of the Manuka, or we call it Draksha, it will be Arishta. So major ingredients, and there are only few ingredients in Arjunarishta. There are only 5 ingredients. That is Arjun Twak, Madhuka Pushpa, Jaggery, and Dhataki Pushpa. The main 2 ingredients are Arjun and Manuka. These 2 ingredients are the major ingredients in the Arjunarishta. So we will see that Arjun, what is the properties of the Arjun? So if you look that their major component or major rasa of the Arjun is a Kasharas and Katu Vipak. It is Shita Viryatmak Dravya. So it is Laghu and Ruksha Gunas. So it the major prabhav, or we can say that it's the major activity is on the Rudhay, that is on cardiac. So it is recommended to elevate diseases, condition like Rudhay Rog, that is heart disease, Rakta Vikar, Rakta Pitta, Pandu, Shwas, and Kandu, Kushta, and hemorrhagia, that is the skin disorder. Also, it can be indicated in Jwar, Medorog, and Asthi Bhagna. Arjuna contains some phytoconstituents, that is the arginosides 1, 2, 3, 4, arjunin, arjunatin. Also, it has the saponins and flavonoids. So the bark is exerting a significant inotropic and hypotensive coronary artery flow that is protecting the myocardium against the ischemic damage. It has also been detected to have mild diuretic, antithrombotic, and hyperlipidemic activity. Recently, 2 new cardiac glycosides were isolated from the root of the Terminalia Arjuna. The main cardinolets are used for the force of cardiac contraction, that is for intracellular sodium and calcium retention. The second one is the Draksha, that is the Vitis vinifera, and the family is Vitis. The name Draksha, it is from the Sanskrit shloka, that is Drakshate, Drakshi, Kankshiya. It is the meaning of that is that the fruit which is having good taste. The rasa of this draksha is the madhur, vireshita, and vipak is also madhur. So snigdha and guru having the properties of this draksha, and the karma, that is it is acting on vata pitta hara, rusha, that is aphrodisiac, bruhan, chakshusha, and virichanapak. So it is used for purgative also. The indications used are jwara, rakta pitta, kamla, daha, and trushna. So there are so many medicinal properties of the draksha, but the trushna, vibandha, kamla, and hrudaya daurbalya are the major indications of this draksha. So grapes are rich in polyphenols, and 60 to 70% of the grape polyphenols are found in the grape seeds. So if you use this grape seed, that is the draksha, so polyphenols which are used as a cardiac tonic also. So it will be beneficial for cardiac, nourishing, nourishing the brain, that is bruhana, aphrodisiac, and promotes taste. So it is also useful for nervous system. So due to their properties elevating what, it is useful for memory power and acts as a brain tonic. It is also useful for digestive tonic and circulatory system. So it is a cardiac tonic and strengthen the muscles of the cardiac system and circulatory system. The other ingredients are the supportive ingredients, and those are acting for fermentation process. The madhuk is the Madhuka longifolia, and it is majorly used for the fermentation process. It has the indications of it is useful for krumi, trushna, jwar, puran, and shawls. That is the for asthma. Also, there is a Dhataki ingredient. This ingredient which is used for fermentation process. And the last one, the ingredient is the Jaggery. The Jaggery is it has self-mature, that's sugar. It has all properties are in itself in the guda. So it is a good source of energy, and it also prevents rheumatic affliction and nerves and blood.
Apologies, we have lost connection to our speaker.
Jeevan, I think.
Palaviji, namaskar.
Namaste. I think his connectivity is what?
Oh, Jeevan's coming back. Jeevanji, namaskar.
Sorry. Yeah, namaskar. Yes, there was a problem in the internet connection. So is it visible? One sec.
You have to start your screen share again. Thank you.
Yeah. One sec. Okay.
Hey, we missed one slide, Jeep, the previous one. Yes.
Jaggery.
Thank you.
Jaggery. So Jaggery, which is his name, that is the good, that is the Sanskrit name of the Jaggery, which means all gunas of the sugarcane are mentioned in the guda. So it is a very much good source of the energy, and prevents the disorder related to fatigue and relaxation of the muscle, nerves, and blood vessels. It also increases the hemoglobin. So we will see the traditional method of preparing the Arjunarishta. So the drugs, the 4 drugs, we have seen that 5 drugs. The drugs has been coarsely powdered, and 4 times of water is added. Then the decoction is prepared, and reducing it water to 1/4. Then it is filtered through a clean cotton mesh, and then it is the decoction was cooled and Jaggery was added and completely mixed. Then the solution was poured into fumigated porcelain jar, and the Dhataki flour was added afterwards. Then the fermentation process is initiated, and after 1.5 month, the Arjunarishta is prepared. So modern methods of the preparation are the little bit changed. That is, the decoction is prepared in the SS vessels, and there is the preparation methods are somehow different. Also, there is a fermentation process are in the SS vessels. So Arjunarishta is then prepared and then checked by various facilities, that viscosity, pH, and all. Arjunarishta in Ayurvedic medicines, there are some indications. Those are mentioned in the Ayurveda. The first indication is Vataj Rudrok, Pittaj Rudrok, Kafaj Rudrok, Sannipataj Rudrok, Krumij Rudrok, Kasa, Shwasa, and Rajayakshma. So this was a study done by Arjunarishta of Sandu. There were the animal study, then molecular mechanism and HPLC study also. So metabolic parameters, IPGT study, systolic blood pressure analysis, tissue TG levels, gene expression, and analysis of ellagic acid, gallic acid, quercetin quantification. This all has been done of Sandu. So this was the research, and the objective was of the research was to evaluate the anti-hyperglycemic and anti-hyperlipidemic effect of Sandu Arjunarishta on high-fat diet fed animals. So the conclusion was anti-hyperglycemic and anti-hyperlipidemic effect of Arjunarishta may be mediated by decreased TNF alpha and increased PGC1 alpha and IRS1. So there is a details of that research paper, and it is available online. So the research paper is this, and the research was conducted by there are 7 to 8 researchers, and they have done this research. So the proven activity of the Arjunarishta is anti-hyperglycemic and anti-lipidemic effect. So the pharmacological properties of the Arjunarishta are as the main ingredient of the Arjunarishta is the Arjuna. It is the improving heart efficiency. Also, bioactive constituents in the Arjuna Bark extract may improve the left ventricular function of the heart. It also strengthens the heart muscles, prevent the deposition of the plaque in the blood vessel, and also avoids the formation of the atherosclerosis, and hence reduces the risk of heart attacks, heart blocks, blood clots, mitral regurgitation, and ischemic cardiomyopathy. It also plays a key role in lowering the levels of bad cholesterol and triglycerides of the body. The hypotensive and inotropic effects of the bark extract of Arjuna plant increases the coronary arterial flow. The cardiotonic property enhances the sarcoplasmic reticulum functions of the heart and minimizes the arrhythmias or heart rhythm of the diseases. So there are two very much keen experiences that was in my clinic. So a 63 years old patient having chest pain and hypertension. So the blood pressure of the patient was nearly 170 by 120, and he has a very severe chest pain. So he was with allopathic medicine, but when he comes to the clinic, I have advised him the Sandu Arjunarishta single medication for 3 days, and the dose for the medication was 30 ml 4 times a day, and the result was very much good. The blood pressure and other chest pain both have been reduced, and it was in the normal condition. Also, the second case, it was the primary hyperlipidemia patient having the symptom of mild chest pain, and he has the lipidemic level a little bit higher side. So Arjunarishta and Pruhatva Chintamani with Kanchanar Gugul is very much beneficial, and it was beneficial within the 15 days only. So reduce the LDL levels and with reduction in the chest pain. So overall conclusion of this study of this Arjunarishta is the Arjunarishta is a traditional herbal remedy, and it is very much useful for various disorders. It holds high significance in treating chest pain, cardiac problems like congestive cardiac failure, heart blockages, angina pectoris, myocardial infarction, and ischemic cardiac myopathy. It is extensive health benefit in various herbs like formulation increase its therapeutic efficacy in treating respiratory issues also. So phytochemicals of the Arjunarishta like flavonoids, glycosides, phenolic acids, triterpene possess antioxidant effect and free radical scavenging ability that can reduce the inflammation of the heart and reduce the inflammation of the body. So overall, Arjuna is, we can say that the Arjun is the cardiac tonic, and we can use this for all purposes of the cardiac disorders like ischemic heart disease and cardiac or heart weakening or as a Rudya purpose. So thank you for listening and inviting me. Thank you so much.
Jivanji, thank you. Thank you very much for extremely detailed presentation with some fine points. I just want to touch on two things before we go to our next speaker.
Yeah.
Thank you for sharing. Yes, thank you very much. Now, you touched on some very fine details about the preparation and the formulations. And the two ones I want to touch on, one is grapes, that 70% of the polyphenols are in the seeds of the grapes. And it's a very important point. And there is a recent move towards seedless grapes. And what is interesting is that the benefits that we might want for what we expect from grapes might not be there in these grapes. Second point I want to touch on very briefly before we go to our next speaker is about Jaggery. And Jaggery has, that's right, Jaggery is there. Jaggery has within it, so it's unrefined sugarcane juice that's been saturated. It has within it a very interesting compound called polycosinol. It's polycosinol is a very fascinating compound that's been used by many countries now to lower cholesterol levels. I will come back to that later. Please let us move on to our next speaker. Thank you again for being with us. I welcome Meenakshi ji. Meenakshi ji, namaskar. Thank you for joining us today. Before we move to Meenakshi ji, I just want to say Meenakshi ji comes to us from Texas. Meenakshi ji, are you there?
Yes, I'm here.
Namaskar. Could we stop?
Namaskar,
I will request Jeevan ji to stop sharing the screen so that Meenakshi can use the screen. Thank you. Jeevan ji, namaskar. Thank you. I just want to briefly mention that Meenakshi ji trained in India, and she studied in Punjab, did her first degree in Punjab, and then went on to do a degree at the National Institute of Ayurveda in Jaipur. And Meenakshi ji, like our convener, Harish Verma ji, are the top students of the university. So Meenakshi ji, I know I don't want to embarrass you here, but that's the truth. You happen to be the best student when you were in Punjab, and you are representing what is called the Punjab Parampara. The Punjab Parampara of Ayurveda goes back to the Maharajas and the Patiala. Many people know Patiala, but they don't understand that there was a very large parampara towards good health and well-being. And out of that parampara was none other than the great Pandit Shiv Sharma ji, who has written a wonderful book about Ayurveda, the past and present, and various other things. So you come from that rich parampara. We look forward to learning from you.
Thank you, Dr. Madanji. Let me share my screen.
Thank you, Ji. Perfect.
Thank you. Thank you so much. So today we are going to talk about the Arjunarishta therapeutic effects in Ayurveda. And first of all, I would like to say thank you to Dr. Harish for inviting me on this wonderful platform. And I love the presentation by Dr. Rohit and Dr. Jeevan. It was very, very informative. There will be a few repetitions and I will skip those slides wherever I see the repetition. So there are various references for the Arjuna. If we see that the references for the Arjuna it starts from the Vedic periods. And where Arjuna has mentioned as a Kriminashka, means it works on the worms, also Balvardhaka and Hridaya, cardiotonic, and also provides strength to the body. And there is a reference for the providing strength to the, not only the physical level, at the mental level also. Then comes the Samhita period, which is our holy books in the form of, in Ayurveda, the Charak Samhita, Sishra Samhita, and the Ashtanga Hridayam. There in Charak Samhita, these medicinal plants have been classified according to the actions and the specific actions. And it is mentioned in the Kashaya Skandha as a Udard Prashmana, means which works on the skin disorders. And there has been almost 84 varieties of asvas where the Arjuna has been mentioned. And as one of the main drug in Siddha yogas also, where it cures the ulcers resulting from the insect and spider bites, that also has been mentioned in the Charak Samhita. Also, it has been mentioned in Charak for the wound healing, also for the one of the main ingredient in the Pushanuk Churna for the management of licoria also. So various Ayurveda Samhita has mentioned Arjuna and its therapeutic effects. So there are certain ethnomedicinal use of the Terminalia Arjuna. We are on the traditional Ayurvedic medicine platform. So I thought to pull out few ethnomedicinal traditional uses of Arjuna. Also, the bark has been described as astringent, demulcent, expectorant, cardiotonic, anti-dysentery, urinary, astringent, and has shown to be useful in fractures, ulcer, licoria, diabetes, anemia, cardiopathy, and cirrhosis. And all the references I have put towards the end. Chakradatta, the great ancient physician, also recommended to be given as a decoction of bark with the milk or the ghritam, clarified butter. And decoction of the bark has been used for the ulcer wash, which bark ashes have been prescribed for snake bite and scorpion sting as well. And the traditional healers from the Kanchipuram district, Tamil Nadu, boil the bark with the water and inhale it to cure headache and kill worms in the teeth. And they also use fruit paste topically on the wounds. Then there is another reference, fresh leaf juice is used for the treatment of earache, and bark powder for treating heart alignment by Malabar tribe, Kerala. And then another reference for the tribals living in Sundargarh district, Odisha, uses dry bark powder along with the rice wash water to treat blood in the urine, and tribes living in Malkangni district chew the fresh bark and swallow the juice as an antacid. So we can see that there are various ethnomedicinal uses of Terminalia, and Arjuna has been mentioned in various forms. So the major chemical constitution of various parts of terminal Arjuna, stem bark contains glycosides, flavonoids, as well as tannins. Roots also contains glycosides and cytosterols, and leaves and fruits also contains the glycosides and flavonoids. And I have put the references also for that. Now, if we see that you have seen the shloka, this shloka in all the presentations so far. So when it comes to the Arjunarishta, it contains the ingredients Arjuntvak, which is the bark of Terminalia Arjuna, Mridvik, Vitis vinifera, the fruit, Madhuka, indica, the flower, Dhataki, the flower, and the good, the Jaggery. And this is the method of preparation which Dr. Jeevan has already explained. So I'll just go through this one like this. And the therapeutic indication of the Arjunarishta is mentioned as per Bhaishajya Ratnavali Hridaya Rog Chikitsa Prakaran as a cardiotonic, Pufus Rog, lung disease, cardiopulmonary diseases. Balakritam increases stamina, and ojokritam increases vigor also. Now, effect of Arjunarishta there is one clinical study which I have pulled together, anti-hyperglycemic and anti-hyperlipidemic effect in high fat fed animals. And the same study Dr. Jeevan also has mentioned. And here, if we see that the Arjunarishta, the anti-hyperglycemic, this study demonstrates the multiple therapeutic effect mediated by insulin sensitization through its anti-inflammatory mechanism. It also demonstrates it decreases the systolic blood pressure, glucose level, triglyceride levels, and which were actually increased in this high fat fed rat animal study. And this present study also represents the action of Arjunarishta and the alcoholic extract of Arjunarishta in the treatment of hyperglycemia, hyperlipidemia, hypertriglyceridemia. The alcoholic extract, there was two studies carried on. One was with the Arjunarishta and one was with the alcoholic extract. And the alcoholic extracts and the Arjunarishta in a traditional method demonstrate a small amount of difference, which I will pull in the next studies. Next was the Arjunarishta alleviates experimental colitis by suppressing pro-inflammatory cytokinase expression and modulating gut microbiota, enhancing antioxidant effect. So this study evaluates the effect of alcoholic extract of Terminalia Arjuna Bark in trinitrobenzene sulfonic acid model of rat colitis, which resembles human IBD. And this treatment relieved the disease activity by trinitrobenzene sulfonic acid induced colitis by decreasing oxidative stress and pro-inflammatory cytokines and chemokine. And it also improved the composition of gut microbiota. The traditional use of Terminalia Arjuna by certain communities in the treatment of gastrointestinal disorder may be related to these effects, which I explained in the previous, when I was talking about the ethnomedicinal effect of Terminalia Arjuna for by the various tribes. Here, this study finding directed therapeutic effect of Arjunarishta treatment in colitis model. Again, it reduces the oxidative level stress by decreased level of nitric oxide. If you here see that there is a decreased level of nitric oxide, myeloperoxidase, and enhanced level of catalase and superoxide dismutase and reduced glutathione. In addition, an improved beneficial fecal microbiome profile and restored plasma zinc status was also revealed compared to the traditional, compared to the TNBS control group. So this present study directs that down-regulated pro-inflammatory cytokinase, chemokine expression, enhancement of antioxidant effect, increased plasma zinc status also promising role in modulating fecal microbiome, which is the potential mechanism for the therapeutic effect of Arjunarishta treatment against the colitis. So there is another study, Terminalia Arjuna protects rabbit heart against ischemic reperfusion injury, role of antioxidant enzymes and heart stroke protein. Chronic oral administration of the bark of Terminalia Arjuna in rabbit caused augmentation of myocardial endogenous antioxidants. This phenomena may be, as per the study, can be termed as a phytotherapeutic adaptation of heart against the oxidative stress and constitute an important molecular mechanism for action of the bark of Terminalia Arjuna. Since in Arjunarishta, we use the bark of the Terminalia Arjuna, which is the main ingredient of Arjunarishta. So here it also demonstrates that Arjunarishta can also be used as an to reduce the oxidative stress, and also helps with the ischemic heart disease. These are the few studies which I have pulled for the lipid lowering studies. This was the animal study where the lipid lowering effect leading to the decreased risk of cardiovascular disease has been mentioned. And there are another study where it was improved the function of vascular endothelium by decreasing the pro-inflammatory mediators, adding to the cardioprotective effect. And then there was an effect on aortic prostaglandins, increased blood flow leading to improvement in cardiac functions, and effect on the myocardial injury marker CK-MB. Indication is action on maintaining membrane integrity, thereby restricting the leakage of the enzymes. So mechanism of Arjunarishta formulation in type 2 diabetes mellitus and F1 generation. From the gestational diabetic mothers also. So here you can see that the effect of Arjunarishta and its formulations, different formulations, chemical characteristic, if we see that there is a gallic acid, alliic acid, and quercetin. It helps in, it works as an antihypertensive effect by decreasing the systolic blood pressure. MRI scan here revealed that it decreased the adiposity. Means it can work through the obesity also. Metabolic parameters, if you see here, it lowers the plasma, the total cholesterol, it helps with the triglycerides, and it up the good cholesterol also. Intraperitoneal glucose tolerance test demonstrate here anti-hyperglycemic effect, improvement in glucose impairment. And at the molecular level, if you see that, obesogenic gene expression, upregulation in the leptin, as well as adipocytin receptors. It helps in that, the molecular level, and also helps with the inflammatory gene expression, downregulation in TNF-alpha, interleukin-6, and toll-like receptors 4, and also helps with the insulin sensitizer gene expression, which helps in the upregulation in insulin receptor, substrate 1, PGC1, and alpha, and that's how it acts on the anti-hyperglycemic at the molecular level as well. So this is the molecular mechanism of Arjunarishta and its formulation. Again, it shows that there is a increased expression of leptin, adiponectin receptors, and Arjuna bark extract in this presentation shows that it exhibited anti-diabetic activity by enhancing the peripheral utilization of glucose by correcting the impaired liver and kidney glycolysis, and also it limits by glycogenic formation, which is similar to the insulin. And this effect can be related to the glycosides, can be related to the presence of tannin, saponin, flavonoids, and other constitution which is present chemically in the bark, which could act synergistically or independently, enhancing the activity of glycolytic and gluconeogenic enzymes. So beneficial effect of Terminalia Arjuna in coronary artery disease, as the Dr. Rohit also explained on the myocardial infarction. The bark powder, this is another study where the anti-ischemic effect of bark powder evaluated in 30 patients of stable angina, post-infarction angina 500 milligram 3 times a day. And the author observed that the mean anginal frequency decreased significantly along with a significant decrease in systolic blood pressure. There was an improvement in ECG changes and reduction in plasma cortisol and serum cortisol level. And I have put the references here also. So modern research on Arjuna, there are various researches. I just pulled the researches on the bark so that we can, because the therapeutic effect and the pharmacological effect of Arjunarishta we were discussing. So evidences from various in vitro, in vivo, and clinical trials reveal that pleiotropic effect of Terminalia Arjuna, such as anti-atherogenic, hypotensive, inotropic, anti-inflammatory, anti-thrombotic, antioxidant actions for the treatment of various cardiovascular disorders. And from all the research studies, it is clearly documented that this plant has a good safety profile also, along with when it can be used with the other conventional drugs. So the hypotensive and inotropic effect of bark extract of Arjuna plant increases actually the coronary arterial flow. The cardiogenic property enhances the sacroplasmic reticulum function of the heart, and it also minimizes arrhythmias or the heart rhythm disorders, both in tachycardia and bradycardia. And Ayurveda also suggests administering the tonic along with either of the other formulations or along or a standalone. So Arjunarishta syrup acts as a natural hypertensive agent which normalizes the blood pressure and keep it under control as a preventative method also. And it also helps in improving the heart function. So it enhances the cardiovascular endurance, which brings the blood pressure to the stable level and maintain the readings also. And especially when it comes to the systolic blood pressure.
Meenakshi, your slides are, okay, thank you. I was just going to say your slides are not moving, but they are now. Thank you.
Yeah, yeah. At that time, that was the only slide which
Okay.
I wanted to explain. Yeah. Thank you so much. I'll stop sharing.
Meenakshi, thank you so much for being with us today. Number one, you have given us a very wonderful historic account that runs from the Vedas all the way, the understanding of this plant. For a lot of people in the community here, they might not understand how knowledge that comes from so way back in time is still relevant, the contemporary relevance. And you have brought all those points out very nicely about the long history of understanding this plant and ethnopharmacology and how it's being used in different parts of the country, different preparations. And finally, you concluded by pointing us to a very interesting point that of a connection with hypertension. And you've shown us how the kind of mother of all disease, inflammation, leads to later problems. And from there, you get to other complications. We are very fortunate to have here with us Ashleshaji joining us from Chicago. Ashleshaji, thank you for being here with us today. The floor is yours.
Yeah, thank you, Madanji. And Dr. Meenakshi, wonderful presentation. Thank you so much for coming and presenting such a beautiful thing. Excuse me for my voice, little not good, but I'll be very brief. So wonderful presentation. I just have one question for you. So you mentioned about everything about Arjuna. Is there any specific study which would show that Arjuna is not only used as a Arjunarishta, but we also very popularly use the Arjuna Ksheerapak, correct? So in your practice or anywhere you have, or during your research study, did you see any difference where you specifically say that the cardiac diseases then go for the Arjunarishta only, or anti-inflammatory effect go with the Arjuna Ksheerapak? Any thoughts, any light on these questions would be appreciated. Thank you.
Thank you, Dr. Ashlesha. Since you know that we all practice in USA, so we are not allowed to use the Arishta and Asava. So I never used here in my practice. Yes, I prefer to use the Arjuna Ksheerpaka, which has the similar effect in a smaller dose that we always use, but not the Arjuna Arishta in the United States, unfortunately, because it contains the self-generated alcohol. Though we all know the benefits of that, but unfortunately, because of the laws and all, yes. Yeah.
Meenakshi, thank you.
Right.
I don't know if that, Ashleshaji, very specific question. I hope it offers you a satisfactory kind of answer to your extremely specific question. I take the liberty here just to introduce the larger context, as said here in Canada, in Toronto, the kind of work that's going on. And I want to introduce you to the institution that is taking a key role in establishing a relationship between India and Canada in this space. And for those who can see on the screen here is an institution called KITE at the University Health Networks. And you can see from this headline of the 26th of April this year, KITE to play a key role in India-Canada partnership. Now, KITE is a research institution that is based and part of the University Health Networks, Canada's largest research hospital network. The relationship that's being formed is with the All India Institute of Medical Sciences. The person involved there and who's guiding this program is shown on the screen. And that is Dr. Paul O, who is the medical director of University Health Networks, cardiovascular prevention and rehabilitation program, and a senior scientist at the KITE Research Institute. So for those who are not on this platform, please access details about KITE at the link on the screen. KITE is an acronym for a very acronym for four very powerful words: knowledge, innovation, talent, everywhere. This network here at the University Health Networks looks at, as on the screen, it's a world leader in rehabilitation research, 128 principal investigators, a large number of publications every year, and a lot of floor space available for research. And India is in discussion with this group, and you can read all about it from the website. Shown here a photograph of the signing of the Memorandum of Understanding between University Health Network and the institution in India, All India Institute of Ayurveda. So I stop here. We are very fortunate to have Ashleshaji. The point here is to look at the possibility of setting up similar collaborations with networks across America. And I know it has come up in previous discussions. Perhaps you have something in your mind very briefly before we go to Harishji, or perhaps Professor C.B. Jha, who is here with us today from Benares. Ashleshaji, in a few words about that point we touched on earlier of developing similar engagements across the United States of America.
So, Madanji, as we have discussed last time also, our efforts are going on. Unfortunately, I don't have any solid thing to share with you, but AUM, Ayurveda Union at Midwest, we are trying to work with the same Consulate General of Chicago, India at Chicago. And with their collaboration, we are trying to develop this sort of same kind of collaboration which we could do it will be taken understanding. We will be focusing more on the Ayurveda and research. Absolutely. So
thank you, Ashley.
We are in that scene,
this is a role model here, the Canada-India Foundation and the Consul General of India in Toronto, and the work they have done in the past few months is a model for how we can develop these interactions.
Yes. So absolutely true, and absolutely we are inspired from them only.
And that's there is also a roadmap and policy document between the Prime Minister's office here in the UK and the Prime Minister's office in India, 2030 roadmap for India-UK engagements. And I will put the details in the chat box. That is another model that is there on how nations are talking together. We are fortunate here to have today with us Professor C.B. Jha. Jha Sahab, namaskar ji.
Namaskar, Madan ji.
Thank you so much for joining us today from Varanasi.
Namaskar to all of you.
Hridaya is a very important part of Ayurvedic physiology.
Hridaya is a very important part, and Arjun is also a very effective medicine and available everywhere in North Belt of India, not only Northeast, North Belt, even entire India, we can say it is available. And as I am a scholar of dosage kalpana and ras shastra, that is particularly related with the manufacturing part of the medicine. So this is a beauty of a drug which we can use in a different way. As per our Charak is mentioning, the Bahuta Tatra Yogyatvam Anek Vidha Kalpana. This is a slok from the Charak Samhita. Bahuta Tatra Yogyatvam Anek Vidha Kalpana. Anek Vidh. So, in a many doses form, you can use a single drug. This will be the beauty of the medicine. So, Arjun is used in the form of churn, in the form of chirpak, in the form of even juice also, if green, fresh, this bark of Arjun when available. So the churna is very frequent. This is a upakalpana of kalk, we can say. And decoction is also very frequent. And the chirpak is a modification of decoction, we can say, upakalpana. So in chirpak, our scholars are mentioning that the chir is moderating the taste and the effect of the Arjun. So the method of preparation is mentioned that Drabyat astugunam chiram chirat niram chaturgunam niravasesam tatkuriyat. So the 8 time of milk is added, and the similar quantity of water added into it and reduce up to the milk. So the water part should be reduced. So this is one which is very frequently used by the Ayurvedic physicians in routine practice, and it is effective also. Then the Arjunarishta or the Parthadyarishta of Arjuna. Whatever the of Arjun means the Arjun, that Arjun, you can say, which was the hero of, you can say hero also of the Mahabharata. So the all synonym of, all name of Arjuna is used for this Arjun, this plant also. The Asava-arishta, the preparation which is discussed by the scholars. All the scholars are presented very nicely and very informative, their presentation. Dr. Rohit, Dr. Jivan Prakashji, and Dr. Meenakshi ji. Everyone given very detailed information on this, the how it acts, how to prepare the Parthadyarishta or Arjunarishta. So, and what are the researches published on this medicine. So detail we have listened from all these scholars, previous scholars.
Draksha,
So,
I'm going to stop you here for a moment because we are a little short of time, but I do want to ask 1 or 2 very specific questions.
Okay.
And that one specific question is, how can we, you have seen the network that the Canada-India Foundation is established in Toronto, and the amount of work that has gone on behind the scene by our leaders, chairman like Satish Thakkerji and others there. And how can we bring a tighter collaboration between India and Canada, Toronto in particular, the University Health Network? I mean, you are one of our senior and greatly admired teachers and professors, and you are based in Banaras Hindu University, a seat of great learning. How can we bring a very vibrant interaction between India BHU or All India Institute of Ayurveda, with large network of researchers and physicians who are very excited to learn about it. How can we do this, and very swiftly, so that we have very tangible projects and big outcomes?
So this is one way. In the form of webinar, we are discussing the matter related with this health. So this way we can collaborate to each other and develop the scope of Ayurveda in detail. Sir, regarding the Arjunarishta, I am trying to say something. Hello?
Please, sir, continue.
Harish is saying something.
Yeah, Dr. Jasab, I have one question for you also. The modern studies have shown that hydroalcoholic extract of Arjuna is very effective in cardiac ailments. But when we are preparing Arjunarishta, we are just boiling Arjuna bark and we are losing hydroalcoholic ingredients in the decoction, which we are preparing in the water only. So do you think there is a need to modernize it?
Actually, on this basis, you can modernize it, but the Arjunarishta is invention of our ancient scholars, and we are using from centuries this medicine successfully with full effect. So decoction is a very potent dosage form of Ayurveda. You must keep this in mind. Life of the decay process starts in decoction. So how the self-life of the preparation and taking this drug or material to make them long-standing, long shelf-life. As Sarangdhar is saying that Puranasya Gunair Yukta Asava Dhatuvo Rasa. So as old as it will be effective even after many years, as Sarangdhar is saying. And in practically we are also observing, due to generation of self-alcohol in this preparation, this preparation is going to preserve by its own the sugar and the this jaggery or honey or the madhuka or the draksha. These are one side, it has great medicinal value and it is an integral part of this preparation, which fermented jaggery, honey and draksha. These all are the sweetening substance, sweet substance, and participating in the fermentation process. And after fermentation, the product which we are obtaining, that is water soluble content of the active content of the material, then alcohol soluble contents of the material, and the some fat soluble contents also. Why fat soluble contents? So during the preparation of pot for the fermentation, we are using some ghee and oil for its lepan, for its lining inside. So this is a unique preparation, which is, we can say that three soluble material, fat soluble, water soluble, and alcohol soluble. So all these three types of content, active content, we are achieving by this preparation. So, and due to its palatability, quick absorption, and quick effect, it is very popular among the Ayurvedic physicians, Arjunarishta. So I think as you are raising the doubt on this, then the preparation, particularly when we are boiling the Arjuna, we are losing something. I think it is not true. it needs some scientific experiment and research also. But the quath preparation, the preparation of decoction is a good sufficient this literature is available on this preparation, particularly for the decoction. Why we are preparing decoction, and particularly from Ashavarishta. In the case of Ashavarishta, as mentioned by the Saranga, that when we are making decoction and fermentating it, that is known as arista, and without boiling, without making decoction, if ferment, that will be Asa. Particularly for the Parthadyarishta or Arjunarishta, the decoction preparation is essential. And it is time tested, this product. So we can't doubt on this preparation. And those who are using, they are getting ice effect. So we can't say that we are losing anything of that. But if we have doubt, we can experiment it, and by the experimentation, we can clear our doubt also.
Jasab, thank you so much. Jasab, thank you so much for being with us today.
Thank you, sir. Thank you, sir.
Most importantly, you have given us opportunity to show how easy it is to connect with the world. You are based today in Benares, and we are discussing with great ease from different parts of the world. I want to bring in Satishji Thakurji. Satishji, Namaskar-ji. And we are very
thank you all. Namaskar from my side also.
Jasab, we are very fortunate to have you here with us, but this is only a start of a large discussion, and hopefully Satishji and the team in Toronto will provide us a platform where we can extend this discussion and have detailed discussions with all the team members who are interested at the University Health Network in Toronto. Satishji, Namaskar-ji.
Ji, namaskar. Absolutely. It was very, very inspiring to learn today how through our Vedas, through one shlokas, actually we have these hidden treasures of various traditional Ayurvedic medicinal plants being, depicted as the source for prevention of the diseases and as well as management. So it was very, very fascinating, and I was very thrilled to listen to all the presenters today. We are running a bit out of time right now, so I will keep it brief. At the Canada-India Foundation level, we are fully committed, 110% committed to this cause, and we sincerely thank all the stalwarts, all our scholars who come from time to time on this platform, and willing to work with each and every one of them in connecting to the modern medicine policymakers. And I think time is right, and we all work together in creating some meaningful impact in the society. So over to you, Madanji.
Satishji, thank you so much. Thank you again for being the energy behind the Canada-India Foundation. Thank you again for bringing us all together with the hard work. Before I pass the floor to Pallaviji, I just want to show here, I started off with a little bit of explanation about the complexity of the heart, the central part of our organ in Ayurveda called the Moolastan of Pranavaha Shrotas. This is where energy flows through. Meenakshi-ji introduced us to that question about hypertension, question about inflammation. And I want to flash very quickly the work here of Mohan Raizada at the University of Florida, and a very important question: which comes first, inflammation or hypertension? And Ayurveda tells us how to understand pathology in a 6-stage process, the Kriya Kalas, the Shad Kriya Kalas. And if we manage to bring together the logic of Ayurveda along with the best of contemporary biology, like what's there at the University of Florida, what is available at the University Health Networks, I think together we can do wonderful things. With those few words, I hope we will come back to meet again to discuss those very fine points that we are touching on and that this event today has brought out for one of the top killer of the world, heart diseases, cardiovascular disease. Satish ji, thank you very much for hosting us again. And Ashlesha ji, thank you. Thanks to the two speakers. I pass the floor to Pallavi ji. Pallavi ji, namaskar. You have to unmute yourself, Pallavi ji.
Thank you, Dr. Madan. And it has been a wonderful session today. I think the speakers have left no room for any doubt for us to ask. And the seat of emotion is the heart. And I think whenever somebody says something, it touches your heart. So I think Arjunarishta should be taken by all of us as a cardiac tonic and help us prevent all these challenges which come in life. So anyway, was really wonderful today, and I would like to take the best part thanking Lord Dhanvantari for bringing us all on this platform and increasing the wisdom towards Ayurveda. I thank my heartfelt thanks to Dr. Rohit Sane and Professor C.B. Jha for being a special guest today here. They have done a wonderful time and sparing the available time for us. Dr. Meenakshi Gupta and Dr. Jeevan Chaudhary, a beautiful presentation. Thank you so much for spending time. I understand how much the speakers have to spend time in preparing a presentation. And Dr. Meenakshi very well pointed out how in different parts of India, this Arjunarishta or Arjun herb is used. And it's really fascinating, the multi-dimensional benefits of Arjuna, what we got to learn. My sincere thanks to Satish ji from Canada India Foundation, who is putting his wholehearted effort in bringing this science out and spreading it globally. To Dr. Harish Verma ji, the Canadian College of Ayurveda and Yoga. Thank you very much, Dr. Harish ji, for your time and effort. You are the hero behind the screen. And thanks to Consulate General of India in Toronto, to CAPA, and special thanks to European Association, Ayurveda Association, Dr. Madan ji. And no words to thank you. You come from that part. Ayurvedic Union of Midwest, Dr. Ashlesha, your inputs are very, very immensely valuable. Association of Ayurvedic Academy, thanks to them. American Association of Ayurvedic Professionals. Special thanks to Tathastu and Pravasi Television, Y Media, and Dr. Madan, you excellently moderate the sessions. Thank you very much. And my special thanks to all the viewers. Our next lecture would be on 30th of October because I think 16th October, there is some special event. So we'll be meeting at the end of this month, and it will be on Chandra Prabhavati. As the name spells, Chandra means the moon, how it has the cooling effect on the body and especially on the urinary tract. And it's a very important aspect related to hypertension. So I expect all of you to join us on 30th October for our next session. So thank you all for your time. Have a good weekend, your Sunday. Enjoy. Namaste, pranam to all.
Thank you. Thank you.
Thank you. Thank you all.